Hello, it's Dr. Elizabeth Alter. Are you familiar with lymphocytic colitis? Lymphocytic colitis is a condition of the colon, and it's known as lymphocytic because it means that a certain line of the white blood cells, known as the lymphocytes, are dominant in the tissue. And usually it's something diagnosed by colonoscopy. So a patient will have a colonoscopy, and the gastroenterologist may note some irritation and take some biopsies, which are pieces of tissue. And then that gets analyzed, and this diagnosis of, um, of lymphocytic colitis is related to the patient. Now, lymphocytic colitis, I'll call it LC for short, um, but it's it's a little more complicated than it sounds. So usually the main symptom of lymphocytic colitis is diarrhea, and the patient's given several options. One is a steroid known as budenoside. The other is a type of medication called mesalamine, and it's also used for inflammatory bowel disease. And then maybe some dietary changes, what's called a low FODMAP diet, which is a diet that's low in foods that ferment easily, hence FODMAP, FOD MAP, MAP. So you can look that up separate. That's a whole other conversation. But these are the options. So in sometimes in a patient's journey with a disease, I always tell patients to keep looking for answers. A lot of times, patients become frustrated when their issues aren't resolved with the standard conventional treatments. And a lot of times, I get calls in my office asking if I'm an expert in a certain disease or whatnot. But I always remind patients that you need somebody, a physician, especially in functional medicine, to just overlook your complete story. Not just this one diagnosis that you were given. I mean, in this case, I'm discussing lymphocytic colitis, but it could be any diagnosis. So, in terms of lymphocytic colitis, I have found that it's it's usually something that happens in older patients. So it could be somebody in their late 40s, 50s, 60s, usually women, and sometimes it's associated with anti-inflammatory medications like ibuprofen or Motrin, things like that. So after you've taken that, it can provoke this lymphocytic colitis. But recently there was a patient that had this, and so as time went on, the diarrhea would come and go. Sometimes it would be better, sometimes worse, and sometimes a supplement would work, sometimes the supplement wouldn't. And in this particular case, what turned out to be the issue was something called SIBO, or small intestinal bacterial overgrowth. Now, the gut is a very complex um, system, so you really need to have patience and search for answers um, without getting too frustrated. It can be frustrating not knowing the answer, but sometimes I've noticed that when patients um, give it time, and they're working with a doctor that can help them navigate all the potential treatments, supplements, etc., you do get to not just what caused the problem, but the resolution. So sometimes I've noted that, and I did a video on this about stevia causing diarrhea. So, and sometimes if you're taking too much probiotic and the same one all the time, not having good variety of foods, it can also provoke diarrhea. And then, you know, sometimes it just gets labeled a diagnosis such as this, as lymphocytic colitis, when in actuality the colon was inflamed for other reasons. But it does mean colon inflammation, but it doesn't tell you why. And so I just invite patients to really um, work with a doctor that can help you navigate, because there's so much information out there and there's so many opinions and um, possibilities. But if but don't get frustrated and keep at it until you find the solution to your particular problem. And so, for instance, in this case of lymphocytic colitis, we pulled back a bit from probiotics. We did some variety of foods and got rid of the stevia, and then helped also with motility. So gut flow was this new supplement that we have to help the movement of the colon, and this was particularly helpful also in this case. But so if you have a particular problem that isn't lymphocytic colitis, just keep in mind that functional medicine can help you get to the root of your problem and also find a more reasonable solution. But sometimes it takes some patience and time to achieve that. Well, I hope this helps and have a healthy day.